So I wanted to do a quick little video talking about diagnosing my daughter with celiac disease. She just had an upper endoscopy this Monday, and I'll tell you all about that experience and kind of what led up to that. For those of you that don't know, I have celiac disease. I was diagnosed like 12 years ago, and celiac disease is an autoimmune disorder. It's the reason why everybody's talking about gluten-free. You know, it's more than just a fad diet. There are many different forms of celiac disease, and then there's also gluten sensitivities, gluten allergies, and those types of things. But celiac disease is a big deal. It's an autoimmune disease. So beyond just an allergy or even a food sensitivity, there's an autoimmune component to that. And so that's why it's such a big deal. And then there's just varying degrees of sensitivities and all that jazz. So when I was diagnosed, it was after I was experiencing some GI issues. So I had like severe abdominal bloating. At one point, I looked like I was like 6 months pregnant, and I was having like black tarry stools and all that jazz. So that's a sign of a GI bleed. So long story short, I wound up in the doctor's office. They did an upper endoscopy, and they saw that my small intestine was so damaged. So you have these like microvilli in your intestine, and like these little arms that help move food along the intestine, and the microvilli help absorb nutrients. So when people with celiac disease ingest gluten, their body basically mounts this immune response where they attack the small intestine and they damage these villi. It's called villi atrophy, so microvilli atrophy. So my small intestine was so damaged that it basically looked like a slip and slide. Like, it should not look like that. When you look at a small intestine that's healthy, there's these folds, you can see the microvilli, it looks very normal. Mine looked like a slip and slide. It was super smooth, so I was not absorbing nutrients. It was pretty severe, but I'm better now. And my daughter wasn't having quite as extreme of symptoms as I was. She was just kind of having these little things off and on. Not frequent enough that I was like rushing her to the doctor or anything, but we do go yearly, and I make sure that every year they're screened because they have a first-degree relative who has celiac disease. And in the past, I test both her and my son. And in the past, I used to only get them screened for celiac disease antibodies, like the comprehensive panel. But this year, I asked both of them to be screened for the genetic test. And I wanted to know if either of my children carried the gene for celiac disease. And a lot of people in our population carry this gene. I've read anywhere from 25 to 40% of our population have the celiac gene. That doesn't necessarily mean you have celiac disease, and it doesn't necessarily mean you're gonna get it, but it does put you at a higher risk for it. My thought process was, if neither of my children have the gene, because I have a 50-50 chance, right, of getting it, my thought was, if they don't have the gene, then I don't have to worry about it. I can rule it out and we can move on with our lives. Well, come to find out, both my kids have the gene, so that was wishful thinking on my part. My son, Kevin, he is 4, and he's fine. He has the gene, like I said, but he does not have celiac disease, and antibodies are negative. He does, however, have an enamel defect on his teeth. It's called molar incisor hypomineralization. So basically, he's missing that protective mineral layer that we all have on our teeth naturally to protect us from getting cavities. That is linked with celiac disease, but he's negative. It's also linked with frequent high fevers as an infant, and it's very, very prevalent in our little kids this day and age. And I bring that up now because, number one, it is linked with celiac, and despite him not having it, I feel like a lot of our kids these days are struggling with ear infections or just frequent fevers for other issues. So I do bring it up, and I think it's something that if you have little kids, make sure you are taking them to the dentist regularly, because it's becoming more and more common. And if they don't have that protective layer, You know, my son got 2 cavities. We had to get caps put on, and then they sealed his baby teeth because it's that big of a deal. You know, they don't usually seal those teeth until you get adult teeth, because, you know, we're going to lose these baby teeth anyways, but because of this issue, they sealed them right now. So anyways, that's him. And then my daughter, okay, so she was having, again, just some mild symptoms. You know, she would sometimes be constipated, sometimes she would be the opposite, and then she would sometimes complain of a tummy ache. It hurt when she was going to the bathroom. She was complaining of like cramping. And then I would notice her little tummy would get so bloated. And I know kids get these like round, cute little bellies, but this was extra. So I just kind of was like, well, I wonder if it's it. And so long story short, this year's screening, she did come back positive for the antibodies. So that's just step 1 of getting diagnosed. After you're positive for the antibodies, the golden standard for confirming a celiac disease diagnosis is to undergo an upper endoscopy, otherwise known as an EGD. So an upper endoscopy, they basically put you to sleep and they stick a tube down your throat. They take pictures and they'll take biopsies of your stomach, and I think they go into your small intestine, like the upper part of it anyways, and they'll that's how you diagnose it, is by looking at it visually. We can tell how severe the damage is, and then the biopsies will confirm, you know, by pathology whether or not it actually is celiac disease or something else. So this part is scary. Nobody ever wants to put their child underneath any sort of anesthesia, but unfortunately it's necessary because, you know, again, this came highly recommended by her physicians because we want to confirm the severity of the disease. How bad is the celiac? You know, with me, like I mentioned earlier, I had a pretty severe, and so that was an indication of my treatment afterwards. You know, I had a lot of healing and repairing to do, and I needed to repair not only my gut, but I also needed to replace a lot of those nutrients. I was malnourished, so I was reassured in my daughter's procedure. Visually, her doctor said it looked, you know, not as bad as we would have expected. If she had not known that we had positive antibodies on blood work, she said there was a couple patches where she would have biopsied anyways because they look like celiac. So we're still waiting on pathology to come back. That'll take about 2 weeks, and that's really, I mean, we're expecting it just to come back and confirm it. We're not expecting anything else because, you know, aside from confirming celiac and, you know, the severity of it, we also need to rule out that there's nothing else going on. You want to make sure there's no other stomach stuff going on. So that's reassuring. My daughter was super brave. And I share this because if you have celiac disease, I want to encourage you, and you have children, I want to encourage you to make sure that you're getting your kids screened. Check for the gene. You know, chances are they have it. It's not necessarily a bad thing if they have it. It doesn't mean that they're going to have celiac disease. But again, if they don't have it, that's one less thing you have to stress about for the rest of their lives. And then, you know, I think typically they do like a comprehensive like celiac panel on people like every 3 to 5 years, but if you have the gene, they may bump it up to like yearly screening just to be a little more, what do you call it, proactive in catching it. What else? So again, I also wanted to share this process because I know what it's like to struggle with getting diagnosed with celiac disease and being told that you have to completely change your entire lifestyle. Being gluten-free is so much harder than I think people recognize. It can be really hard for people that we live with too. Lord knows my mom has to be super careful when she's cooking in our house because like we can't share a toaster because of the crumbs that are in the toaster. If those crumbs get on my food, like if I'm out eating and somebody brings me a salad and forgets to take the croutons off, I can't just pick the croutons off because those crumbs are in there. And there are different degrees of severity with celiac patients. There's like a true celiac, and then there's like a latent celiac, and then or a non-reactive celiac. So depending on which side of that spectrum you're on, I mean, you could have celiac disease and not have any symptoms, and that's almost scarier to me because if I'm treating a patient who doesn't necessarily react when they're eating celiac, number one, it's going to be harder for them to comply with the diet, but number two, you know, they may think that they're being successful at being gluten-free, but then when we go and we put them under and they get an endoscopy done, we may see damage to that villi, and that could be a really, really bad thing. So it's harder to measure. So my process with my daughter going gluten-free is going to be interesting. You know, it's hard for kids. She's 5. If there's a birthday party at school and somebody's bringing cupcakes, I need to know ahead of time so that I can make sure she has gluten-free cupcakes or options. But so far the process with their school has been okay. I mean, they deal with allergies all the time when it comes to like peanuts, and you know, there's so many different kid allergies out there these days. So when I called her nurse and I told her she needed to be gluten-free, they were like, okay, here's a form, have the doctor sign it. And that was I just submitted it on Tuesday because she had her procedure Monday. So we'll see how it goes. They're saying that they can cater to her and give her this meal that I guess comes like pre-wrapped. So she'll eat that. I kind of want to make sure, like as a nutritionist, I want to kind of see the quality of the meal. That's just me. Right now I'm packing her lunches. What did we do yesterday? Okay, so she loves Lunchables. So I made her my own version of a Lunchable. I cut up some lunch meat and some cheese, and I got her some gluten-free crackers. And then we did some fruit, and I think she had a Glutino is the brand. It's like a Nutri-Grain bar. I stuck that in there too, just in case. And then today, she didn't really like the crackers. I think with gluten-free food, it's all about trial and error and figuring out what you like, especially with like pastas. All pastas are different when it comes to being gluten-free. Like I know I have my favorites. Now I got to kind of figure out what hers are going to be. She didn't like the first macaroni and cheese I got her this weekend, so we'll see. Today she did a peanut butter and jelly sandwich. I got her some gluten-free bread. But again, with like cross-contamination, I had to get her, because her and my son used to eat peanut butter and jellies all the time. So, you know, when you're like making a sandwich and you dip the peanut butter or the jelly in and you slap it on the bread and then you dip it back into the jar, well then there's crumbs transferred. So you have to be kind of careful with that. So, you know, we now have 2 sets of peanut butter and jelly in the house, and one's labeled GF. So we know it's gluten-free and to be careful with that. So these are just things that I have learned in my experience. And, you know, like I said, it was hard for me 10, 12 years ago when I got diagnosed. There wasn't as many resources out there. There weren't as many gluten-free options out there. Certainly dining out was a heck of a lot harder. Nowadays they have apps that you can use. You can scan the barcodes on foods and they'll pop up and they'll tell you, hey, this is got gluten, wheat, triticale, barley, you know, all the different variations that you have to avoid. There's also apps for dining out. There's one called Find Me Gluten Free, and you can just like put in your area and it'll tell you what restaurants have gluten-free menus. It'll pull up the menu, it'll have reviews. Because it's one thing to have a gluten-free menu, and then it's an entirely different thing to be knowledgeable in the cross-contamination and preparation and all that jazz. So celiac disease is super common in people with certain symptoms. So like if you have anemia, obviously nausea, vomiting, constipation or diarrhea, if you're having abdominal pain, bloating, it's linked with people with diabetes, especially thyroid disease. I also have Hashimoto's thyroiditis. They say autoimmune diseases come in pairs, and it's linked in females with infertility. So these are just a couple things. You can go to celiac.org if you suspect that you have if you're having any of these symptoms, or if you're just kind of curious, or if you have a first degree relative, so think parent, child, or if it's not a first degree relative, if you just have it heavily in your lineage, like if you have multiple people in your family who have it, not necessarily first degree, you want to get screened. So these are just some of the things that I've learned, and as I'm navigating a gluten-free lifestyle with my daughter, I will keep you guys posted, you know, in an effort, you know, if there's other parents kind of dealing with the same thing, maybe you guys can give me tips and tricks. Maybe I'll learn something that I can pass on to you. So hopefully this video saves better than my last one, and I will be back on here next week.